A very warm welcome to Channel 1 Lunchtime News. My name is Irene Mchuma Odim, and I'm not alone. There is a whole team behind this live broadcast on sign language interpretation. We have Lensa Odingo. Do interact with us on our social media platforms at KBC Channel 1 on Facebook, YouTube, and Twitter. Top story this afternoon: increasing cases of mental health problems among young people across the country has seen local faith and community-based organizations teams roll up out of a 3-year project to help those affected. The project that is supported by Christian Aid Kenya also seeks to help affected individuals whose condition can be reversed medically. The project has already been rolled out in Isiolo town, which has been identified as one of the areas with an exceptional and will be introduced in Nyeri, Kilifi and Nairobi counties. According to Christian Aid Kenya, most of the new cases across the 4 counties are as a result of drug and substance abuse, especially among the youth.
So this project basically will be trying to advocate for offering of quality services for people with mental health services. We'll also try to support governments to be able to increase allocation of funding that is going to mental health, because mental health has not been properly funded.
Our main objective is to break the barriers to accessing mental health services in Isiolo County, and we are hoping some of the strategies that we are planning to use, we are going to engage, that is creation awareness to the community members. We are also incorporating the mental health persons.
Hii ni jambo ambao kwa muda mrefu watu wamekataa kuzungumzia. Hata serikali ingeweka rasilimali ama budget ya kushughulikia mambo kama haya. Watu wengine wakigojeka na akili wanawekwa manyumbani, wanatupiliwa, wanaachiliwa na kuwa neglected. Na hivi leo tumejua kumbe hii ni shinda ya ugonjwa kama magonjwa yale mengine ambayo inastahili kuwekewa rasilimali, inastahili kuajiriwa wafanyikazi wa kutenda tendo hili. Na sisi kama viongozi wa dini mbalimbali siku ya leo tumehamasishwa jinsi ambavyo tutakuwa mashujaa ya kutetea wale ambao wameathirika kiakili.
From Isiolo, we go to the county of Mombasa. My colleague Michael Mwandiga is doing a follow-up on developments in regards to mental health programs set to benefit youth in the area. Mwandiga, good afternoon. Would you bring us up to speed with the latest developments from the county of Mombasa?
Good afternoon, Irene Mchuma. We are coming to you live from Utange in Kisauni sub-county in Mombasa County. Of course, today we are having here the CAS, that is in ICT and Youth Innovations, Madam Nadia Ahmed, who is today launching a pilot project for youth for mental health here in Kisauni sub-county. Of course, she'll be briefing us and putting into perspective all what about this project and why the girls in Kisauni sub-county. Welcome, Madam Waziri. And kindly put it into perspective. What about today's event and why here in Utange?
Hello everyone. So today's event is very important because mental health has become such an important aspect in our lives, and that is because of the COVID-19, how it has changed how we think, how we do things, and how we just go around with our lives. The reason why we came to Utange is because of the rise in teenage pregnancies that are here, but also the rise in teenage marriages, and that is because a lot of girls have been out of school for a very long time. Some have not even gone back because of the little amount of money that they don't have, and so it's become so rampant. So we sat down with our ambassador, Kenani Mimi ambassador in Mombasa, and we realized that it is important for us to really teach them about the importance of mental health, but at the same time to bring back that identity and self-love. Wasichana wengi hapa, it's like as if hawajipendi na hawajithamini, and because of COVID-19 wengi wazazi wao wamewatenga. So nilikuwa lazima tuje hapa tuanzie hiyo pilot program ili tuweze kuwaimarisha waende shule, lakini pia tuwafundishe matatizo ya akili.
Okay.
Yes.
Na mkiangalia labda statistics zenye ziko tayari, ni wasichana labda ni asilimia ngapi, na labda matatizo ambayo yanawafanya kujiingiza katika ama kujipata katika hali hii ambapo wanakuwa na mimba za mapema?
Kwa sasa sina statistics, manake timu yangu watakuja na report wanieleze, lakini katika reasons ambao wanafanya mimba za mapema nimechukua kwa wao ni kwa jambo la kwanza wanasema hawapati upendo kwa wazazi. Jambo la pili wanasema wazazi wao wenyewe wana struggle kuwapeleka shule. Kwa hivyo lazima wao wapate pesa kipande zingine. Jambo la tatu ni mambo ya period poverty. Hawana pads, hawana pesa za kununua hivyo. So wanapata vijana wa bodaboda wanawadanganya, wanaambia njoni mufanye hivi mupate. Na jambo la mwisho ni ile pia pressure. Wanaona wenzao wako na ma boyfriend na ma girlfriend, na wao pia wanasema wataka kuingia katika hicho kikundi na waendeleza. So ukiangalia ni pia rebellion. Wasichana wako bored, wasichana wengine wanachochana, wasichana wengine wanadanganyana. So it's a lot of things, but most importantly period poverty, wazazi kuwapatia upendo, na kitu cha tatu wazazi wao hawana pesa.
Okay, so thank you so much. That is CAS for you, ICT Youth and Innovations, Nadia Ahmed, putting into perspective why the pilot project here in Kisauni sub-county. Of course, she has said it all, what is causing this this problem, and the project is all meant to ensure that to give them just a positive side or a positive step to start on in their life. Of course, this pandemic has caused a lot of problems. Of course, many families have broken apart just because of the problems which have been brought about, the socio-economic problems brought about by the pandemic. But moving on, we'll be putting you posted on all the events, or what will be unfolding soon after this event and the way forward. Coming to you live from Mombasa County, I'm Michael Morgan. Back to you, Irene Mchuma.